I have the pleasure of being here today with Roger Barr. He is a homeopath and he has a very interesting education around homeopathic medicines. He has also healed himself naturally with homeopathic remedies, which I'm really interested to hear more about that. And he has a website and practice called youcanhealyourself.com, which I love.
Actually, the website is canhealyourself.com.
Canhealyourself.com. Thank you. And which is great because that's something that I truly believe in, the healing power of our bodies, the innate healing power of all of us, which homeopathy has a lot of support and benefit in that arena. So the first question I have for you, Roger, is what is homeopathy? What are homeopathic remedies?
So nothing I say can convince you about the power of homeopathy. It challenges all our beliefs in the mechanistic paradigm of life. You have to experience it. So my intent here is to encourage you so that you can be curious and you can try homeopathy yourself. So to do that, I'm going to share my experiences. Conventional medicine is amazing in the emergency room, fixing broken bones, life-saving surgery for mechanical injuries, hip and knee replacements, etc. We've all been weaned on the mechanistic paradigm of life, like we're all biochemical meat machines. But medicine can't explain consciousness. Is that just a more complicated meat machine? Are you a meat machine? And then there's the blood-brain barrier, which prevents or limits most drugs from crossing into the brain. And yet every drug we've looked at has lots of unique mental and emotional symptoms, side effects. So discovering homeopathy is like Alice going through the looking glass. Homeopathy has been accused of being placebo, but those that have studied placebo have found that it's only really effective while taking the placebo and only for conditions with a strong psychological component like pain. Meanwhile, homeopathy has more than 220 years of well-documented clinical history of long-term cures after stopping the remedy, even for so-called incurable diseases. And it's estimated that between 300 and 800 million people use homeopathy as their primary form of medicine worldwide. My first exposure to homeopathy was in 1990 when I returned to Oakland, California from Australia on a 13-hour flight, and I was extremely jet lagged. And a friend at the time offered me a homeopathy class, and I was unemployed, had nothing better to do, had no idea what homeopathy was. So I said, sure, why not? So I'm sitting in this class, and he's talking about all these bizarre concepts. Like cures like is the basic principle of homeopathy. And I said, well, what is that? And he says, the mental, emotional, and physical symptoms that homeopathy causes, that a homeopathic medicine will cause, it will cure the same constellation of symptoms in an individual. And then he talked about the real kicker, which is the extreme dilutions, where frequently the remedies have little or none of the chemical left in them. So I thought, oh, this is just all New Age BS. But he started talking about all these remedies for jet lag. And I thought, oh, well, what the heck? So I started reading through these remedies, and one of them was gelsemium. Mm-hmm. And I was reading, and it said that it will cause and cure foggy, hazy vision. And I realized that's exactly what I was experiencing. It was like this fog over my vision all the time. And so I took the remedy, and the instant it touched my tongue, it was like somebody cleaned the windshield. My vision, the fatigue cleared. I just, it was like gone, completely gone. So I decided, well, I'll go to a professional homeopath for the leftover symptoms of dysentery that I had from it being poorly treated 6 months prior in India. I had bleeding gums, insomnia till 4 or 5 a.m. in the morning, gas, poor confidence. He gave me a remedy, and it all cleared in a month or so. So I started studying homeopathy. In 1995, I was diagnosed with malaria by a regular doctor in an epidemic in Maharashtra, India. And I later read in Asian Business Week that 10,000 people died in that epidemic.
Wow.
I was a newbie homeopath, and foolishly, I tried to treat myself. And as an aside, let me say, unless you're trained, don't treat serious acute or chronic conditions, but do treat simple acutes, like, for example, first and second degree burns, minor injuries, insect bites, etc. It'll give you confidence in homeopathy. So I went to an MD homeopath in Nashik City nearby. And in India, they have a homeopathic medical system that's equivalent to the conventional medical system. They have a regulator, they have medical schools, they have hospitals, they have doctors, etc. And this MD homeopath had to ignore all the symptoms that I'd caused by giving myself the wrong remedy repeatedly. So he gave me one dose of the right remedy in his office, and 3 days later, I was completely cured. And I had no relapse. At the time, malaria was considered to be incurable with the quinine drugs they were using. And people would typically have a relapse 6 months, a year later on a regular basis. And I had never had a relapse.
And now you have no residual symptoms or relapsing symptoms of malaria.
No, it was all gone in that 3 days. Completely cured. No just sequelae, as they call it.
Yes. Yeah.
So what is this like cures like? So what that means is the constellation of mental and emotional symptoms that a medicine causes, it will cure in an individual with a similar constellation of symptoms. So what they do is they take volunteers who do what's called a homeopathic proving. So they take the remedy and then they carefully record all the temporary new symptoms that the mental, emotional, and physical that it causes. And that information is then used by homeopaths to decide whether or not that remedy is appropriate for their patients. Now, this sounds kind of bizarre.
Yeah.
I found that every conventional medical drug has side effects that match the indications for which the drug is prescribed. And I found this by investigating the top 500 drugs and found no exceptions. So, for example, aspirin, ibuprofen, acetaminophen can all cause fever and headaches. Ritalin is an upper, methylphenidate, I think is the term.
Yes.
And in a healthy person, it will cause effects that are like having ADHD. Well, it's used to treat kids that have attention deficit hyperactivity disorder.
Right.
Radiation and chemo drugs can cause and sometimes cure cancer. SSRIs and antidepressants can cause depression and suicidal and even homicidal ideation. Budesonide is an asthma inhaler. And if you look in the side effects, it says paradoxical bronchospasms. Well, it's only paradoxical because they don't understand homeopathy.
Interesting.
So I encourage anyone to prove me wrong. Go to sites like drugs.com or whatever. There are lots of sites that have side effects of drugs, and do a search on drugs, their indications, and their side effects, and see if you can find any exceptions. I'd love to hear about it. So in my opinion, conventional medicine is practicing bad homeopathy. They're temporarily suppressing or palliating a few symptoms, like a poorly prescribed homeopathic remedy that's only matches on a few symptoms. It's not curative because they're not matching in mental, emotional, and physical symptoms of the patient. I call it biochemical whack-a-mole medicine. If the same drugs were prescribed that matched the mental and emotional and physical effects to all the symptoms of the individual patient, it would be curative like a good homeopathic remedy is. The definition of homeopathic is that the mental, emotional effects of the drug match entirely the individual's mental and emotional and physical symptoms. Individuality is most important. The same influence on the health can have different effects at different times in different patients. And so I'll give my experience with poison oak as an example. So before I used homeopathy, when I would get poison oak, it was just this nasty rash that would last for 2 weeks without, just totally miserable for 2 weeks, dripping, whatever. It was horrible. When I started to use homeopathy, I cured it 3 different times, but each time it was a different homeopathic remedy. There were different symptoms each time. The first time I was restless, and hot water made it feel better. And the remedy that worked was poison ivy, made from poison ivy. It's called Rustox. Right. And as we all know, poison ivy can cause a similar kind of rash to poison oak. The second time, I was not very restless, but I was extremely sensitive to hot water. And the remedy that worked for me was anacardium. Each time I would take the remedy, it would go away in half an hour. And the next day, it was like I never had it. It was just phenomenal cures very rapidly. So now I'm not even susceptible to poison oak. I just get a little bit of a reddening, no itching. And that's what a good homeopathic remedy will do. It will remove your susceptibility to the influence, or remove or reduce your the influence of that health impact.
And so I have a question about that, if I may, with the individuality, because I know that's a really important piece to homeopathy. But then there's, let's say, arnica, one of the best known homeopathic remedies for bumps and bruises, strains and sprains. Can that still be used, generally speaking, after a fall or a bruise? Or are you saying it still won't be as effective as a constitutional or an individual remedy?
Well, arnica has specific indications, which is the etiology is a blunt trauma. The effects are bruising and sore pains, and there are other indications. But if somebody's in an accident, they can have other kinds of responses. Like some people might need the remedy opium, which is they're kind of out of it. They're not really there. They're
right.
They're not sensitive to. They're low sensitive to pain. They're kind of in a fog. So yeah, arnica is just very common because that's a common response to blunt force injuries. But there are other remedies too. If you look in the homeopathic repertory, there are other remedies that are used for blunt force injuries. So right. It's just very common. That's all.
Okay.
And like for another common example is food poisoning.
Yes.
Everyone should have arsenicum. It's a remedy on hand because it's such a common remedy for food poisoning. But there are many other remedies that could be indicated for food poisoning. So.
But for someone's, let's say, first aid kit, I know in my first aid kit, I also have a few homeopathic remedies. I have arsenicum, I have arnica, I have aconite. So can these still, as you mentioned before, it's not good to maybe treat yourself because you don't want to have to go backwards, like in your case with the malaria. But let's say someone's having acute food poisoning. Could you still give arsenicum, or it's not ideal? It's best to work with a homeopath in that moment.
No, I encourage people to use them for acutes, but you have to know what you're doing.
Right.
You give the remedy a couple times. If you see no improvement, it's not the right remedy. If you start to see some improvement, hey, repeat it. It's pretty much that simple. Keep doing what works and stop doing what doesn't work. So.
Okay.
So
yes.
Go ahead. I was going to say, let me continue with a simple explanation of like cures like.
Yes.
It's such a controversial principle of homeopathy. Every drug has a simple explanation is that every drug has a primary action on the mental, emotional, and physical level. But when it wears off, there's a secondary reaction of the vital force in the opposite direction. So an example of that is the drug we all know and love, which is coffee. And I could write a book about coffee. People have written long treatises on coffee. It has so many effects. So of course, I'm going to simplify here. But the primary action of coffee, typically lots of racing thoughts, emotionally hyperexcitable, physically jittery with a rapid pulse. And then when it wears off, the secondary reaction, the mind slows, the mood is low, people have fatigue, and they want that second pot of coffee so they can get back up again.
Right.
I call it the perfect capitalist drug because you can do, at that hyperexcitable state, you can do any boring task all day long. So let's take an example of a patient who has insomnia. And insomnia can manifest in many different ways, as we all know. Some people have trouble falling asleep. Some people wake up in the middle of the night. Some people wake up too early in the morning. And there can be all kinds of symptoms along with the insomnia. But let's take one particular individual that comes to the doctor for insomnia, and the doctor just gives them the sleeping pill, gives them Ambien. And Ambien has no relation to their other symptoms of, it doesn't cause any other symptoms related to their condition. So it forces them to sleep. And then the next night, the vital force is pushed back in the opposite direction. They're wide awake. They need another Ambien. And then the next night, another Ambien, et cetera, et cetera, et cetera. And so so they want to get off this, the treadmill of conventional medicine. So they go to a homeopath. And so the homeopath asks them, well, tell me about your insomnia. And the patient says, well, late at night when I should be falling asleep, my mind is racing. I have all these thoughts. I'm a little hyperexcitable. My pulse is jittery, so the homeopath says, well, that's a coffee-like state. So they give homeopathic coffee. It gives a little push in the same direction, and then the vital force pushes in the opposite direction towards cure. And so it's actually curative of the insomnia instead of just temporarily suppressing it.
That's an interesting way to look at it. I hadn't thought about that before.
Yeah, people think of homeopathy as being this bizarre, obscure out there, but it's really just, what we've all experienced as far as how drugs act. But the other aspect of homeopathy that's challenging is the extreme dilutions. But that's not an essential principle of homeopathy. Originally, Dr. Hahnemann, the founder of homeopathy, practiced 30 years with no dilutions. But he was concerned about the wisdom of giving toxic substances, all medicines are toxic, to healthy people. So he started diluting them, and he developed a process of dilution that he called potentization that actually made the remedies more effective, even when there's little or none of the substance left. And he was a famous chemist in his day, so he knew about Avogadro's principle. He knew that he was diluting beyond the point where there's any of the substance left. And there's no known mechanism. There are many plausible theories, but we have to conclude that it's energy medicine using some unknown energy, and we're more than just meat machines. And you too can discover homeopathy by experiencing it.
Yes, great explanation, Roger. And so to just go back to Hahnemann, you're telling me that when he first started, he was giving, let's say, belladonna in its true form, like no dilutions. He was just giving belladonna as a homeopathic remedy.
In drop doses. He knew that they were really powerful, and he didn't. And because they were homeopathic, they were very effective. But yes, he was using undiluted substances for 30 years and getting good results. He was well known in many circles in Europe for, treating, epidemics and all kinds of stuff. And, but yeah, after 30 years, let's say that would been about, the 1830s. Yeah, he started to do the dilution, and he realized, wow, this is even more effective, so.
Amazing. So this leads me to my next question for you. You had mentioned that you had thyroid problems previously, and you also healed your thyroid naturally with primarily homeopathy. Tell me more about that.
Well, as Dr. Lipinski writes in her book, homeopathy is not, I mean, hyperthyroidism and hypothyroidism are not limited to the thyroid.
No.
They're systemic ailments. They
Yeah.
may or may not be cause, reduced production from the thyroid, but it may be other things like bad conversion from T4 to T3 or whatever. There are lots. And so, giving one or two chemicals is not going to relieve symptoms. It may relieve the symptoms, but it may not cure. And I was just reading recently in an article, it was really good. It said, today, functional hypothyroidism arising from nutritional deficiencies, environmental chemical exposure, hormonal imbalances, or metabolic dysfunction is recognized as a distinct and common presentation frequently missed by standard TSH and T4 only diagnostic approaches. And I thought that was a very good summary. So to answer this question, the best way I think is to give excerpts from published cases that have been used for training. So there's no HIPAA violation or anything here. I'm just going to quote from these cases.
Okay.
So on March 30th, a clerk aged 40 years old asked for help for her eyes. Her eyes troubled her in her clerical work. They bulged more than usual. She had head pain in the occiput with stiffness of the neck. Her thyroid gland was enlarged, quite prominent. She was given a remedy or two. By September 30th, her thyroid gland had reduced to the normal size. She had congestive headaches now. Her eyes improved, and she was still taking a remedy. So that's the first case. The second case is a case of Hashimoto's thyroiditis that had been medicated for a year. The patient went into Hashimoto's 1 week after the death of her father. And I have to say, as an aside, it's common for autoimmune conditions to have a history of some emotional trauma.
Absolutely. I see it all the time. And it's one of the triggers that can break the camel's back or be maybe the only thing that happened in that individual's life that really started the cascade of this autoimmunity.
Right. So after the homeopath gave her the first remedy, she immediately developed an intense sore throat and swollen glands that would go right to left to right to left, and so on. He finally gave her the second remedy, and her energy immediately increased more than it ever had been on the thyroid medication. Eventually, he weaned her off the thyroid medication, and she's doing fine. The third and final case is a 40-year-old woman with a nervous breakdown. Excuse me. She feels tired and depressed and doesn't feel like doing anything. She cannot concentrate. She feels suicidal and wants to cut her wrists. Everything is worse when she has lots to do, when she has to take care of herself, and when the weather is warm and damp. When she drinks alcohol, things go a little better, and it helps her through the day. When she was a 7-week-old baby, she had to go to the hospital because there was something wrong with her thyroid. So she was given hormones. When she was 14, her thyroid was 100% inactive, which is just phenomenal.
Wow.
And she's quoted as saying, "Nobody wants me to commit suicide, but nobody wants to be there for me either." 1 month after the remedy, she feels a lot better. The other misery has gone, although the fits of depression still come and go. 6 months later, she no longer feels suicidal, and she has moments when she does not feel depressed anymore. After a year, she tells the homeopath that other people have started to like her because she no longer bothers them with her sob stories. I thought that was a beautiful case.
Amazing. And so, and you personally, though, also had improvement using homeopathic remedies for your thyroid.
Actually, no. I had hypothyroidism long before I found out about homeopathy. So what happened for me was at 14 years old, I was given high-dose tetracycline for 2 months for acne. And it's as you know, it's a broad-spectrum antibiotic, and it destroys the microbiome. And it's contraindicated for growing kids. And it stunted my growth, and tetracycline is associated and maybe causative for hypothyroidism. And tetracycline definitely causes candidiasis, which is an overgrowth of yeast. And hypothyroidism probably contributed to the candidiasis as well. Candidiasis led to my depression, and they say that candida can go to the brain. So I was 14 years suppressed with suicidal ideation, and I only did the psych drugs for 6 months. I realized it was a dead end. But fortunately, my brother introduced me to nutrition, but I had no advisor or internet to consult. So finally, after another 14 years, I overcame the candidiasis and hypothyroidism with diet, supplementation, no sugar, kelp, and dulse, which are high in iodine, and trace minerals. So I was functional again, but still somewhat depressed. So then I did 5 10-day silent Vipassana meditation retreats, and the depression lifted in the 5th one. And I remember the exact moment. It was phenomenal. That's my experience with.
And how old were you at this time when you did the silent retreats?
My 5th one was, I was 28 at that time when I did that.
Wow. Amazing. And so with the candidiasis, have you had recurrence of that going forward at all?
I would say no. For years afterwards, if I ate a little bit of sugar, I would get a little bit of athlete's foot. And that's about the only, that's as bad as it would get. I didn't get any, all the severe, cravings for sugar and all that kind of stuff.
Yes. And I bring that up because I had candidiasis. And for people that know, candidiasis is candida that essentially goes systemic. A lot of people think of candida as a yeast infection as it typically presents, but it's not only that. And one key symptom that comes up is intense sugar cravings and brain fog, and often presents with skin issues too, like peeling hands and feet, or what's often diagnosed as fungal hands and feet. I experienced this when I was younger, and I do see a pattern in a lot of my thyroid patients with history of candida or recurring candida as well.
Mm-hmm. Yeah, it was I would say that the candidiasis left at one point. It was pretty clear, but I was still susceptible to things like sugar, and bad diet would trigger. But it wasn't severe or anything. It was livable.
And so this leads me to my next question in terms of homeopathy and everything you've explained to us so nicely about like cures like and so forth. When I learned about homeopathy, I also learned about these obstacles to cure. In some individuals, there's these, difficulties in really allowing the body to heal and restore its natural healthy state. In your opinion, what are some of the big obstacles to heal, or what prevents people from healing sometimes?
So I'm going to talk mostly in terms of homeopathy, but these issues are universal. So, as I said earlier, Dr. Hahnemann founded homeopathy in the 1800s. And at the time, there weren't a lot of obstacles to cure like there are now. He talked about severe mental and emotional obstacles like ongoing abuse or fear, lack of appropriate exercise, lack of appropriate nutritious and non-medicinal foods, drinks, etc. And he advised reducing mental exertion and eliminating emotional shock. In the modern age, we know there are many more obstacles to cure. In fact, studies have shown that conventional medicine by itself is one of the leading causes of death. And I actually saw a study recently where the guy combined a lot of different studies, and he felt that conventional medicine was the leading cause of death. So obviously it can be an obstacle to cure. And there's some of the drugs, like long-term prednisone and so forth, that can really suppress the healing response. I certainly prefer herbs to drugs, but even herbalism, frequently it seems like it's practiced like allopathic or conventional medicine using herbs instead of drugs. And these herbs have strong energy. Taking 2 different herbs at the same time is like riding 2 different horses at the same time and going in 2 different directions. They're the essential oils like camphor, tea tree oil, peppermint oil, strong herbs, especially coffee, strong odors, perfumes, colognes, mothballs, whatever. recreational drugs like marijuana. These all can interfere with
Mhm.
And then we know now about inflammation and leaky gut, which can lead to autoimmune diseases. And there are many causes, and one prominent cause that we all know about now is glyphosate, which has a broad spectrum of effects. And it's widely used on soy and corn, and it's even used to dry wheat. So you're getting a massive amount of it from commercial wheat. And then, of course, there are the toxic foods like sugar, fried foods, processed foods, and oils that all can lead to leaky gut and autoimmune conditions and stuff like that. Overeating can be an obstacle. And conversely, we now know that intermittent fasting can be healing.
Yes.
Dental root canals are a big obstacle to cure, and most people are not aware of. You have a piece of dead bone in your body, and it has lots of micropores, and the bacteria move in and set up shop, and the body has no way of flushing it out of dead tissue. So it's like having a permanent infection, and it can cause, among other things, cardio and cerebrovascular events. EMF energy can interfere with the healing response. They all can interfere with homeopathy by suppressing the characteristic symptoms that the homeopath needs to identify the right remedy. And it also can make it difficult to determine if the remedy is working properly because you have other impacts on the health, and so you don't know whether it's the remedy acting or whether it's this other herb that someone's taking. So
Right. And so with the root canals, this is fascinating to me. My dad's a dentist, and I have a real special interest in oral health and how it impacts the body. In individuals that have root canals, but they've had a cone beam scan where we can see there's no inflammation, everything seems to be fine, there's no issue there. Do you think the root canal is still, point blank a problem? Or if there's no, or do you think some people can tolerate root canals, other people can't?
I think if someone has chronic conditions, some chronic condition, and they can't find some other explanation, it's worth considering the root canal. I had, I think it was 4 or 5 patients who had root canal. There's a chart. I forget who the doctor is that created, a naturopath created this chart where each tooth is on a particular Chinese meridian.
Yes.
And so by looking at the meridian where the root canal is, you can identify what ailments a person might have. All 4 of these patients had the conditions that were indicated by the placement of their root canal. So I definitely, and there are books you can read on it. I'm not the expert, but I've read a couple books on the subject, and I think it's well worth considering if you have a chronic condition that's not amenable to natural healing.
And so for these individuals, did they have an implant placed, or they just took the tooth right out and then had a hole in the area where the tooth was?
They just told me they had a root canal. I don't know the specifics.
I'm saying, like, if someone's thinking, I should maybe get the root canal out. So then the next steps would be, well, do I get an implant or do I just leave it with the hole there?
Well, I think there are now good implants. The zirconium dioxide is now considered it's a ceramic. It's not a metal, but zirconium dioxide is a ceramic. And that's supposed to be a very good type of implant. The titanium implants, they say it's like having a permanent acupuncture needle on that meridian, which is something you don't want to have. It's a metal. You don't want a permanent metal acupuncture needle on a meridian. So I would say you're going to do that. But if it's not bothering you, like I had this in my, it doesn't bother me, So I don't think anybody looks at me and goes, horrible, So I don't know. Am I horrifying you by showing you that?
No, I think some people feel they want something. So I always like to kind of talk about the different options that are there. And I think some people don't realize with implants, like you're saying, there historically we had the titanium or we had the ceramic, but they looked just ceramic, but there was metal underneath. So people didn't realize that they were putting metal in their mouth.
Right.
Sometimes this wasn't explicit to them. So as you say, I also agree that zirconium seems like a good biocompatible option.
Right. Right. Yeah. There's that, and you could do a bridge, but I don't like bridges because then you're like destroying two teeth to replace one tooth, which is, I mean, not destroying it, but you're
Augmenting.
yeah.
Yes.
I don't particularly like bridges for that reason.
And for the obstacles to cure, one more piece I wanted to circle back to is the coffee. So do you think some people can tolerate coffee? Again, just like the root canal question, or do you think for the most part, coffee is not ideal for humans?
That first friend who gave me that homeopathy course, he said, he knew people that would stir the homeopathic remedy in France. France, they drink a lot of coffee. They would stir the remedy right into their coffee and drink it and still get benefit. So it's really an individual thing. I had an antidote. It's called antidoting, when the homeopathic remedy doesn't act because you're taking something that interferes with it. And most people conclude, and myself included, that it's a very individual thing. It's what you're susceptible to or not. And for some people, coffee, they're very susceptible to coffee. A lot of people are, but some people aren't. And like for me, I was susceptible. My remedy wasn't acting, and I was using a tea tree oil toothpaste. And then I stopped taking it, and then the remedy started acting. So you just have to, I just tell people, be precautious for the first few weeks until we're sure the remedy is working for you. Then you can start adding some of these things back that you want to try, like coffee or whatever. See what's. And I wanted to finish one more aspect of that obstacle to cure.
Yeah.
There's a fundamental principle of healing. Dr. Hahnemann talked about the natural healing process, and that was codified by one of his students into what we know as Hering's Law. And what it says is that natural healing starts on the inside and progresses to the outside. And the inside being important organs like the mind, heart, liver, etc., and the outside being skin, hair, etc. And natural healing also goes in the reverse order of the appearance of symptoms. So symptoms that arise most recently will heal naturally first, and then older symptoms will reappear briefly, and then they'll be healed, and you heal in reverse order. Well, conventional medicine routinely violates Hering's Law. The prime example being, of course, dermatology. They suppress skin symptoms, and then the disease migrates deeper into the organism. A typical example is an asthma patient. They come to a natural healer, and the healer cures their asthma, and then weeks or months later they come back and they say, "Oh, now I've got this skin problem that my dermatologist cured when I was a kid by giving me this ointment." Well, that's what happened. He suppressed the skin symptoms. The disease, he didn't cure the disease, it just migrated into inside more deeper, more serious organs. Asthma can kill you, whereas a skin rash is just a serious concern maybe. So I just want to say, we know that diseases are not localized to a particular organ system, as conventional medicine supposes. Every disease symptom is a manifestation of the disease of the entire body. The whole body, all aspects of the mind, emotions, and physical body must be cured in order for any local symptom to be cured rather than suppressed. Suppressing localized symptoms is, as conventional medicine often does, leads to deeper manifestations of disease. That's why they have such a poor record of treating chronic disease with few cures.
It's very interesting. And that I do see a lot, and it's also interesting you mentioned that asthma and the skin, because they go together so tightly. A lot of people that have asthma also have eczema or dermatitis and so forth. And they're thought of two separate things, but I see them as, kind of the same energy within the body presenting differently, or same imbalance presenting in different ways.
Mm-hmm.
So finally, Roger, is there any, and you mentioned this a little bit, because as we take homeopathy, sometimes we get reemergence of old symptoms and so forth, but are there any side effects when taking homeopathic remedies?
So a properly prescribed and dosed homeopathic remedy has no side effects or temporary mild effects, but there may be a healing crisis. And know it's a healing crisis because a patient improves dramatically afterwards. But an improperly prescribed remedy, repeated often, can cause symptoms. It's like a homeopathic proving. And of course, I gave the example of treating myself with malaria with the wrong remedy repeated. And I was in a health food store one time, and I was talking to this woman, and she said, "Oh, I gave my son Thuya for his warts, and his warts all cleared up. But now he's acting kind of weird." I said, "Stop. He's done with that remedy. Don't give it to him anymore. He's proving it's causing him symptoms, mental and emotional." So homeopathic remedies may be sugar pills, but they're not harmless. For serious acute and chronic conditions, work with a professional. But in an emergency, take the remedy and go to the ER. I was living in a downstairs apartment in Berkeley in the 90s. And my landlord, who was a nurse, came down in the middle of the night holding her 4-year-old girl who was screaming in pain. She had otitis media, an infection of the inner ear, and just horrible. And they had a flight to Hawaii the next day. And so she had to be healthy or they would miss that flight. So I asked a few questions, gave her the remedy, and we headed off immediately to the ER. And when we got there, the nurses said, "Why'd you bring her? There's nothing wrong with her. Her ear is fine. She's not crying. Why are you here?" So we turned around and went home. She'd been cured. And they left on the Hawaii, the vacation the next day. So I encourage people to self-treat for minor acutes. As I said earlier, like things like first and second degree burns, minor injuries, insect bites, etc. Get a kit and some books, treat your pets, treat your plants, treat your family for minor acutes, etc. Build your confidence and get experience to trust homeopathy. And there are many things online. Nowadays, it's so easy to find so many resources online that you can use to learn and to practice homeopathy.
Yes. Thank you, Roger. And I think, I really am all for medical freedom and exploring. I do think, as you've mentioned many times, working with a professional, being overseen, because I think I do believe in healing ourselves, but I think sometimes too, we need that guide, or we need someone to give us, to also see ourselves in a different light. Because sometimes, especially with homeopathy, right, we think we're presenting one way, but we miss a piece of the picture as well.
Yeah. I mean, Hahnemann talked, very early on in his Organon of the Medicine, his Bible of homeopathy, is you have to be an objective observer. Well, how can you be an objective observer about yourself? You can't. I don't try and treat myself for chronically with homeopathy. I go to another homeopath and they say, "Oh, you got this, and this." I go, "Oh, really?" You have to be objective to be a good homeopath, and it's pretty hard to be objective about yourself.
Yeah. And for emergencies, like I mentioned in my little first aid kit, I have a few homeopathic remedies, but going to the ER and being seen is such an important piece of that whole thing too.
Yeah. I mean, like I said, taking 1 or 2 doses of the wrong remedy is not going to cause a problem, so do your best and then head off to the ER, and then once they, patch you all up, then come home and start dealing with your aches and pains with homeopathy. You know? And, do it yourself.
So Roger, can you please tell me again please say the correct name of your website so people know where to find you.
My website is canheal, HEAL, yourself.com.
Wonderful.
And I have an article about how medicines work, both homeopathic and conventional, which people might find interesting.
Amazing. It was such a pleasure speaking to you, Roger.
Likewise. Thank you very much for having me.